Hello, everybody. I'm Evan Hunt, Chairman of the Health, Labor, and Pensions Committee. Tonight we have Health and Human Services Secretary nominee and Acting Secretary Kenneth Quinones, who is having a hearing to try to get the acting title sliced off. I am joined by Senator Lampros, and this is being recorded by Matthew Sorrells. I'd like to give a big thank you to Matthew. Without further ado, we will now start with Kenneth's opening statement. You may begin.
Thank you, Mr. Chairman, and thank you, Senator Lampros, for attending here, and along with Senator Hunt. And thank you, Associate Justice Matthew Sorrells, for recording this. I was nominated because the President Adam Evans trusted me to take lead with this department on covering all issues, whether it's health, the health issues, or helping our communities, making our country a better place, making our children's healthier, providing and combating all of Mother Nature's raft, which can lead to crisis and outbreaks. Um, Hopefully, in this hearing, I could earn your vote. I may not know as much. I will say that right now. I may not know as much, or I may not please you or satisfy you with my response to maybe some of your questions. But hopefully, I hope that my future actions as secretary can cover all that up. Thank you.
All right, we will now start with the first round of questioning. Each senator will get 10 minutes, technically, but I highly encourage, due to the nominee's very short time frame, to not and yield your time before the 10 minutes. I highly recommend 3 minutes and will cut you off and advise you to stop if you exceed 3 minutes. However, under legality, you do have 10 minutes. Now, Senator Lampros, you may start. We will start with the District 2 Senior Senator, beginning now. Okay. The senator would like me to read the questions, right? Can you read talk or not, John? I'm going to take that as a no. So, Acting Secretary Quinones, what is your opinion on the war on drugs?
Well, thank you, Senator Lampros, for bringing up that question. I guarantee it's a very important question for us all as Americans. War on drugs, of course, had its pros and cons. I do believe that illegal drugs should not be in the United States, nor should be easy to basically get access to. I support a strong stance on making a policy along with the rest of the administration um, to combat illegal drugs. President Evans and I will work closely to find a new strategy, of course, along with Congress, to combat and tackle the drug substance that continue to affect the people in our country. Illegal drugs should not be entering, and I would support and work with the Secretary of Homeland Security, if there's any secretary on there, um, to put forth a strict health standard measures to everyone.
Okay, thank you. Question 2. What drugs should be legal and what drugs shouldn't?
Hey, give me 1 second. I had it to move. Okay. I'm sorry. May you repeat that?
What drugs should be legal and what drugs shouldn't?
Well, the list can go on and on about drugs that are bad and that can cause harm to everyday Americans. But I do believe that heroin, cocaine, meth, uh, and other drugs that are similar, related, or correspond with those drugs, they should be uh, nowhere near in use anywhere across the United States, mainland, or the territories. Um, but we can potentially, I don't know too much about all the drugs. I will be honest and transparent with you guys. I may not know a lot of drugs that can cause harm to the American people, but of course, if I do more research into it and work with Congress to combat the issues on uh, those drugs, which drugs to be um, more to classify certain drugs illegal, which drugs are harmful, and of course do a what the FDA is working on uh, about cigarettes. Cigarettes are harmful, and I believe that we should, under the department, I will advise the president to work on a health campaign about a lot of uh, drug substances that can really harm the human body.
Okay. My let's see. I asked the senator to designate 1-6. Should we make drugs legal to lower the use, or should we continue the restriction on drugs?
Okay, give me 1 second. Let me try to read that question. Sure. One thing, I believe that if we make any or all drug substances legal in the United States, I believe that the drugs will be given to potentially children and infants, pregnant women, and our elders, basically affecting everyone, and it could basically affect the American lifespan, which is not a good thing. The UN also reported, I believe, correct me if I'm wrong, the UN reported, give me 1 second. I'm sorry, that was my mom. Um, the UN reported that the United States lifespan has decreased due to our health conditions, our standards, the way how our health system work, the drugs that have been affecting everyday Americans. So I believe that there has to be drugs that are most impactful, such as the one I referenced earlier, cocaine, meth, heroin, etc. They should I support the banning of those, and of course, and use law enforcement to enforce that banning, because it's for the protection of children, pregnant women, elders, and everyone across the United States.
Okay, thank you. Now, due to that, we will be moving on to my questions because unfortunately the nominee stated that he does not have much time. If we can, we will try to do a round two where we will try to finish the remaining Senator D2's questions. Sorry, Senator, it is just that the nominee has to go to bed very soon. Let's start off with my first question. What are your thoughts on the current healthcare system about Ubi Care? What are your thoughts on Ubi Care?
Thank you, Senator Hunt. I believe that Ubi Care has been a very basically an icon for the middle class and the low income families. I believe that that um, it has gotten us in a better place. A former president, John Oberfeld, committed his presidency to reform and present a better healthcare plan for the American people. It helps millions of Americans, and I would work with members of Congress to expand it to cover all Americans who are in need of healthcare, of a healthcare provider. I do support the expansion. I have written, I believe, a 9-page uh, legislation that I would hopefully, if confirmed, present to Congress, and also makes more edits before presenting it to Congress. Work with members of Congress and see what their constituents see and hopefully present a reform that expands and that covers more Americans than we expect.
Okay. Do you believe that undocumented immigrants, should be given health care?
Well, thank you, Sandra. That is a very important question. I believe that if you pay taxes, contribute to our economy, and help out the community in any form, way, or shape, then yes, they should be given access to health care.
Okay. Uh, with that, I have to ask one more question. Do you believe that healthcare is a given right?
This one's we've seen that question all over the Democratic debates. Personally, and politically, yes, I do believe so, because healthcare is and should be given to everyone, regardless of their place in the community. Um, Everyone has the right to get uh, health and treatment to better live a prosperous life. Um, as we stand by those values, the right to live, the right uh, to the pursuit of happiness. I believe it's important. So I stick by that. Yes, healthcare should be a right, and it is a given right. So thank you, Senator, for that question.
With that, we'll go to round two with Senator Lampros. He had some other burning questions. I will allow. Let's go to question 5. What is your opinion on the drinking age being lowered to 18?
Okay, thank you, Senator Lampros. As many of you guys, give me 1 second. Give me 1 second. Okay, I'm sorry. It's my mom again. So I do believe that when I was in Congress, I have fought against the drinking age to be lowered down to 18. I fought due to health concerns and the issues that it could impact young adults, 18 to 21. Um, I thought that we can see more drunk drunk driving, arrest. We can see more accidents. We can see a lot of. We can see uh, young adults, 18 to 21, becoming alcoholics because of uh, basically easing uh, the alcohol laws. And I do believe that it should be brought back to 21. I would fight for it to be back to 21. And of course, I will work with Congress to find a common ground on all issues, including this. This is very important to me, especially when it comes to lowering a substance that can affect the human body in many ways and can cause Lord knows what. So I do support increasing the age back to where it was, and I would work with members of Congress to find a compromise on this issue.
Okay, thank you. Well, Mr. Lampros, let's see, Senator Lampros' other questions. Yes. Question. What is your healthcare? Okay, well, that was kind of already answered by the nominee. Question 2, we already answered. Let's go to question 4. Question 8. Do vaccines cause autism?
I'm going to be honest with you. I have not done research to see what vaccine or what does vaccine cause autism. So I cannot give you an answer on something I haven't researched on that. But I would do the research and get back to Senator Lampros shortly on that. But I will not, and I can't give an answer on that. So I'm sorry.
Are you a pro-vaxxer or anti-vaxxer, and what is your justification on your stance?
Okay, so personally, I do get vaccinated for my well being. Of course, that's me personally. Um, but again, there might be some religions that prohibit vaccinations. Uh, I've seen quite a few TV series that um, I'll hint that out. Grey's Anatomy, family didn't want to get his son vaccinated due to religious beliefs, and I believe that it should be left uh, if that should be up to the parent whether to get their child vaccinated or not. But of course, that should be also given to the states. Of course, in cases such as entering school, a lot of schools across the United States ask for uh, vaccination records. So again, I believe this is more of the state's field, but personally, I do get vaccinated.
Okay. Um. uh, are you, as you know, many bills did do bills to what? As you know, many people did do bills to combat the opioid crisis. Will you add anything further?
Well, I believe that the opioid crisis is something very serious, and it has impacted millions of Americans, and it has gotten them addicted to the drug. So I believe that I would work with members of Congress and the administration to combat and tackle this drug addiction known as the opioid. And of course, I would have to do more. So, wait, my mom's talking to me.
Chase, I think you just missed it. I think he has to go.
What?
I think Kenneth has to go now, but let's see.
Okay, okay, give
Uh,
me 1 second. Give me 1 second.
Kenneth, we only need 5 minutes. I just want to
Okay,
watch Senator.
I think that's how much I can probably spare. Um, anyways,
So,
okay.
I would like to also remind that I would like to allow the junior senator of District 2 to ask some questions, as he has not been given the opportunity yet, and you have to go to bed soon. So, Senator Stevens, would you like to ask the nominee any questions?
Thank you very much, Mr. Chairman. Mr. Quinones, first, how are you doing tonight?
I'm fine, thank you, Senator Stevens. It's good to see you in the other chamber now.
Well, thank you very much, and it's nice to have you at that table and to answer these questions. The first of these being is that I haven't heard the previous questions from the previous senators, but what is your opinion on UbiCare, and do you think
That
it should be?
question was already answered, Senator. We just
Okay.
don't know.
Well, what?
But I mean, if the senator wants me to give like a brief response, that's fine.
Yeah, and if you do have a positive or negative opinion, what would be your replacement program, or if you would do anything to reform it?
Well, I support UbiCare. I congratulate the former president, John Oberfeld, for accomplishing uh, such heavy tasks that right now reforming that healthcare will be very difficult. But of course, I support the expansion of UbiCare. Um, and I have a bill. It's called the American Health and Human Services Reform Act that I would gladly, if confirmed, release to all members of Congress. And I would hope that everyone can come and collaborate with me to reform our healthcare system. I know it's been our conservative friends. We're trying to push something. I've seen mental health. You're opening up for mental illness. I saw that. You've been pushing for mental reform, for opportunities for people who have mental illness. So I praise that, but I have a 9-page bill that I would gladly release to everyone and work with members of Congress and the president uh, to find common ground, of course, and tackle that issue. So one thing, UbiCare, I do support it, and the expansion, Senator.
Well, two questions. I'll go with this one first. How do you plan to expand UbiCare?
Okay. One, of course, many people try to accomplish by covering glasses, dental care, hearing aids, and of course, give me 1 second.
Looking up the answers much?
No, it's people have been pressuring me. Okay, so Evan, I'm gonna have to cut this short, but to back to you.
Well, we have the senator of District 4 here. Do you think that you could stay for 3 more minutes?
I could answer like 1 or 2 more questions. I have to go. But anyways,
Okay,
let me finish Chase's
well,
question.
okay, and then I'd like to move on to Senator Sanders' questions for you, and then you can go.
Well, I'll just make a quick old
Can I
speech.
finish my questions?
I'll just
I
make
have
a quick old statement real quick, just for the record. I think the questions that have been asked so far are questions that I had on my docket ready for the secretary, and I'll ask the senators.
Do you have a burning question?
1 second. I'll ask the senators who have attended this meeting previously how the acting secretary has answered those questions so far. But I'd just like to say that despite Kenneth's public appearance in this community, he is a hardworking member of this community, a hardworking legislator, and I believe that as Secretary of Health and Human Services, he'd be able to efficiently do the job well enough, and to be able to discharge the duties as Secretary of Health and Human Services.
Thank you for that statement, ranking
Well,
member.
I'm not done yet. And to efficiently do the job in a way that needs to be done. And may I just remind the members of the Senate that Secretary of Health and Human Services is not a very powerful position, and holding that position to the standards that we would in real life is quite unrealistic for MEC, and I don't think anyone would truly meet the standards needed to be Secretary of Health and Human Services in real life. So I think just look at his record, look at the 60 bills he has passed as a legislator in MEC, and just know that he would actually get work done. And we haven't had a Secretary of Health and Human Services, and it's time to work on expansions to UbiCare. And I have been in talks with Acting Secretary Quinones about this, and from what I have heard of his vision, I believe that he is a competent enough nominee. And after hearing his answers to the questions asked tonight, I look forward to eyeing his confirmation and making sure that he is our next Secretary of Health and Human Services. I yield my time, Mr. Chair.
Okay.
Thank you, Senator, for those comments.
Mr. Chairman, may I finish my question?
Yes, you may ask a question until the nominee has to go to bed.
All right. Mr.
Which is probably 1 or 2 more questions.
Yeah. I only have 1 or 2 more prepared. But
Okay.
Mr. Quinones, it sounds like your main objective as the Secretary of the Department of Health and Human Services will be to pass this this HHS reform bill. Do you think you could tell us exactly what that bill contains? Kind of hit the highlights or bullet points of it.
Sure. So the bill contains the expansion of UbiCare, which here, let me pull up my bill so I can read from text. So it expands to covering glasses, hearing aids, dental coverage. Give me a sec. Let me continue to look for it. Yeah, so it does come for dental, visionary test, glasses, hearing aids, that's for blind citizens, and help with prescription drugs, but it also prohibits the United States Department of Health and Human Services to basically not offer coverage for surgeries that, for example, like plastic surgeries, breast implants, glute surgeries, nose jobs, like for self improvement. They are not covered under this reform.
Here, if I can
And
ask you really
also,
quickly, would and I know this might sound like a crass question, but will sexual related surgeries or sex changing surgeries include exemption from this, or
uh,
would they be included?
that falls under self improvement. That will not be covered under this reform. It only covers up for emergencies or like for example, a kid needs a kidney transplant or needs a surgery. Then yes, we will cover that. But if it's just for self improvement or to change your sex or to get breast implants, that will not be covered under it. And it explains more briefly in detail, the bill does. And also, it charges a fee depending on which plan you get. There's three different plans. They charge a small amount of fees, and that income of those fees will also cover up some of the more expenses for the expansion. Um, so it all covers up well. Um, but again, I look forward to working with all members of Congress to find common ground on how should we expand our healthcare system and how should we provide it to the American people.
All right. My next question, there's a follow up, but this is the last question, is what do you think should be done by the United States federal government, if anything, to decrease the price of pharmaceuticals?
I always championed President Adam Evans when he fought against pharmaceutical companies to lower the prescription drug prices. He fought as a senator from the Midwest region. He fought hard for the middle class to lower prescription drugs, and guess what? He got it done. As Secretary of Health and Human Services, I will work forward more with the president to combat pharmaceutical companies who take advantage of millions of Americans and um, provide the best drug, and also reform our FDA to make sure drugs don't become too addicted, such as opioid, which led to the opioid crisis that got too many millions of Americans addicted. So I look forward on combating that as well. But we look forward on lowering or enforce to keep lowering the prices on prescription drugs for, of course, people who are elders and for infants and children in America, and of course, help the adults who need assistance when purchasing prescription drugs.
And for my follow up question, then I'll yield. Do you believe that American citizens should be allowed to purchase pharmaceuticals in other countries due to the significantly less prices in those countries?
I believe that we shouldn't be interfering with what the American people want to purchase or not. I believe that's not for me to say, but if you want me to give my own self opinion regarding without the administration, I do believe that the people should purchase whatever they want. As Secretary of Health and Human Services, I just have to make sure that the drug is good for the American people, get it FDA approved, and then we can, of course, give it to the American people at their will. But I don't support interfering with what the American people want to buy or not. I believe that the administration should not be involved in that. Personally, I don't speak on behalf of the administration. I just speak for the department, not the entire administration. But hopefully, the administration don't get to that stage, Senator.
Mhm. But so you would support getting rid of the restriction that does not allow Americans to buy pharmaceuticals from, say, Canada and have them shipped here to be able to pay for the significantly lower price. You would support getting rid of that restriction?
Correct.
All right. Before I yield, I'd just like to say, from your past record, you know that I haven't been the exact champion of it. However, at least from what I've heard, it sounds like being the Secretary of the Department of Health and Human Services may be a good fit from you. From what I've seen, I've been very impressed. Um, and I'd have to say that first, of course, I'll have to look through the previous questions in the hearing, but as of now, I am leaning an eye, and I hope if you do get confirmed that you can serve this nation and its people well, fight for them, and ensure that their health care is taken care of, and that they can be healthy and live as long as possible. And with that, Mr. Chair, I yield the floor.
Thank you, Senator.
Now, Secretary, would you like to make a closing statement?
Yes, thank you, Mr. Chairman, and thank you for all the senators who came here and gave their time to attend my hearing. I know this is extremely late. Forgive me on that part, but it's probably the only time I had free today. um, but I hope that, despite me, hopefully I've gave you a good response to all of the questions. If not, then that's on my fault. Um, Again, I may not know as much. I'm being honest here. I may not know as much. Of course, I may not know all the health codes in the United States, nor know a lot of health laws. But I believe, as being the top advisor to the president on health issues, working with Congress and combating the crisis that comes across in our way, I believe I am best fit for that. Of course, if I did not satisfy you with my response to your question, forgive me on that. That's on my fault. But hopefully, I believe that I could earn your vote and your trust, and hopefully that sooner we can work together on improving our healthcare in America.
Right. Thank you. With that said, this hearing will be over.